Guys, do you hear me?
Yes, we do right now.
Okay, thank you. Right now we have 6 students. Okay, so to make it fair for all of you, we're going to start with Danita Burgoa, then we will have Danita Zamorana, then Brisa Montoya, then Diana Gonzalez, right after Bernardo, and the last one will be Marcela. Okay, so let's get started. Uh, Give me 1 second, guys. Okay, now we can get started with Danita Burgoa, okay? And don't forget, at the end of the class, we're going to have our daily survey. Hello, Danita.
Hi,
How are you doing?
I'm doing well. Thanks.
Okay, so from now on, we have your 15 minutes. Okay, and
Okay.
okay, so yesterday we talked about medical treatment and therapeutics, right? What do you what kind of disease would you like to talk about according to medical treatment and also therapeutics?
We could talk about maybe um, I I'm not really sure. Um, okay, diabetes.
Okay, so you have a lot to talk about. Okay, so I'm all ears.
Okay, um, the type 2 or I don't know.
Okay, type 2 diabetes would be better, right? Because as we were saying yesterday, it will be more related to some parts of the therapeutic assistance rather than type 1, right?
Yes.
Okay, so type 2 diabetes, you can start
Type 2.
telling me. Yeah, it would be easier, right? Because there are a lot of things to talk about.
Okay. Well, for the therapeutics are um, the patient has to we have to control the diet of our patient, and the patient doesn't have to eat sugar. Obviously, um, we recommend a diet with like I don't know how to say in replacement of sugar, and the patient can use I don't know, maybe for example stevia or
Okay.
another about the diet. Also, we recommend physical activity and blood glucose tests. About the medication in these patients, well, there's a lot to talk about. First of all, we can talk about the oral medication.
Okay.
This medication include there's I remember right now 2 types of the oral medication of diabetes, but I'm not really sure about the names in English.
Okay. Like metformin, right? And the other one, that one's right.
Yes. Well, the first type will be bueno, in Spanish, sulfonylures.
Okay, great. What kind of example
And
could you give
the
me
other,
with that type of medication?
okay, the the libenclamida.
Okay. And what does that medication do?
I don't remember. Oh, okay. Let me think. Just a little bit, please.
Okay. It actually makes the pancreas to release more insulin, right?
Yeah, yes.
Okay. So that's what this kind of medication does, right? And what about metformin? It has a different type of action mechanism.
The metformin, it's a when in Spanish, abiguanida.
Okay.
This the most well, the metformin is the most, how I say it, la más comúnmente usada o la más conocida.
Okay, most commonly used, right?
Oh, okay. Well, I remember about the metformin that there's some kind of alteration in the metabolism of the cells.
Okay, so
Like,
in big words, this kind of medication makes the peripheral tissues to get more, how do I say this? It's like this medication increases actually lowers the resistance to insulin in peripheral organs, right? So insulin has a more powerful effect on peripheral organs, right?
yes, yeah, that's what I remember. I didn't remember. I don't remember very well. Um,
Okay, so did you know that all type 2 diabetes patients, when they use this kind of medication, especially the first one that you told me, after years of using this kind of medication, they actually end up just using insulin, right?
after, yes,
And why do you think that happens?
what, I'm sorry, I didn't understand the question.
Okay,
Can you repeat it,
yeah,
please?
sure, don't worry. This the two kind of medications that you told me. After years of using this both medications, at the end, this kind of patients end up using insulin. Why do you think that happens?
Um, when we talk about the first type of oral medication, like you said, um, well,
Yeah, especially the first type.
the, um, well, I I don't remember exactly what it. Oh, how I
Okay,
say
okay, I'm listening. How can you say what?
hypoglycemia,
Sorry?
hypoglycemia.
Okay,
Que,
that is there's a higher risk, right? So in Spanish would be like glibenclamida es un hipoglucemiante y la metformina es un normoglucemiante. You're telling me that, right?
yes.
Okay, when we talked about the action mechanism of the first one, it's actually like this medication is making the pancreas to produce and release more insulin. So it's like there's a lot of a higher effort from the pancreas for so much time that at the end the pancreas cannot produce any more insulin. So even though this kind of medication is already being used, it does not have any effect because the pancreas is not longer working anymore. So this kind of patients actually at the end have to use insulin because the pancreas is not longer working because the first type of medication that you told me made it work harder than usual. Okay, so besides medical treatment, and what kind of any kind of any other treatment that you might be using in this type 2 diabetes, not medications?
Mm, the insulin, insulinotherapy, but you said no medication.
Yep,
Um,
besides medication.
mm, okay. The diet, the patient doesn't have to eat sugar, exercise, and well, maybe education about like give some kind of, I don't know, like classes or something about what the patient has to eat. Um, they have to drink water too. Um,
Okay, and what about, let's say
uh,
you're, okay, I'm listening.
the weight control too.
Okay, great. Okay, so let's say you're from internal medicine and you need your patient to see, would you need your patient to see some other specialty to have a better control of your patient's disease?
Mm, yes, he, I would I will send him to endocrinologist.
Okay,
Uh, what that was the question, or no, no, okay, nutriologist, nutritionist, or something like that. I don't remember.
okay, and what about some medical specialty? For example, ophthalmology, right?
Oh, yes, well, because it could have a lot of like the disease can when it's not treated well, it can affect other organs like well the eyes, the kidneys, um, mm,
Okay, so it's like
okay.
a global treatment, right? Between a lot of specialties, actually would have to look after some medical or surgical complications, and then maybe we would have to
Oh,
take control of, for example, I don't know, as you told me, the ophthalmologist, maybe a nephrologist, maybe a vascular surgeon if this
oh,
patient has diabetic foot, right?
yes.
So there's a lot of specialties we might have to talk to.
Oh,
So,
yes, yes.
okay, okay, Danita, we're done with your time. Okay, I'll see you at the end of the class, please, for the daily
Yes.
survey. Okay.
Okay, doctor. Before that, um, I want I wanted to know if we can replace the other practice class that I missed.
Okay. We can do it tomorrow. Okay. Uh, you're the first one today, so it's
Oh,
kind of
sure.
difficult. You're joining us tomorrow, right?
Yes, yes. That's
Okay.
why I thought that I will be the last one, but okay.
Please, to me, we're going to do it
Okay.
tomorrow, please. Okay.
Okay. Okay. Sure.
Okay.
Thank you.
Okay. So I'll see you at the end of the class.
Okay.
Okay.
Thanks.
Bye.
Bye.
Hello, Danita.
Hello, good night.
How are you doing?
I'm fine, thank. And you?
I'm getting better. Thank you. Um,
Oh,
okay. From now on, we have your 15 minutes. Okay.
okay.
Okay, so yesterday we were talking about medical treatment and therapeutics, right? Would
Yeah.
you like to discuss any kind of disease related to both topics?
Disculpe, no sé si le entendí bien. Quiere que le diga una de las enfermedades de la última parte de ayer, ¿verdad?
Not one of those that we talked about yesterday. Any kind of disease that you might want to talk about or feel more comfortable talking about.
Ok. Mm, of treatment of chronic kidney disease.
Okay. What could you tell me about the treatment of CKD?
Are you hear me?
Yes, I can hear you fine.
Okay, thank you. The treatment, the CKD, is the therapeutic treatment is control your blood sugar if you in the patient when the patient had diabetes.
Okay, it's patient, okay, and diabetes.
Diabetes.
Yes, diabetes, especially type 2 diabetes, right?
Yeah.
Okay,
Um, Keep a um, healthy blood pressure, and the exercise is very important this for these patients. Uh, and the patients don't smoke or use tobacco.
okay, tobacco, okay,
Tobacco. I don't know.
yeah, okay, what else?
Um, oh, it's very important. Uh, it's very important. Keep a healthy weight, and when the patient has a complication, it's very important talk to the doctor about medicines that can help. Um, yeah,
Okay, what kind of diet would this patient have to follow?
um, the diet is basic on vegetables and fruit.
And
Uh,
what would this patient not have to eat, or eat small portions of those types of food?
oh, okay. Um, is mm, soda. No sé cómo se dice en inglés. Gaseosas.
Okay, soda.
Soda. Okay.
Okay, okay.
Um, uh,
What
orange lemons.
and
Uh,
what could you tell me about meat, for example, proteins? Can this kind of patient eat a lot of meat, proteins?
yeah. This patient eat the eggs. fish and a ver, and salad, seafood.
Okay, seafood. Okay, but could this patient eat beef, for example? We're talking about carne de um, vaca. Could this patient eat
Oh,
this kind of meat?
I don't know. I
Okay,
don't know. Sorry.
okay, don't worry. Actually, this kind of patients do not have to eat a lot of proteins. Okay, and why is that? Because you know that you know what creatinine is, right? And where it comes from.
Can you repeat, please?
Okay, no problem. Do you know what creatinine is and where it comes from?
Creatinine?
Yes.
The creatinine is, oh, I don't know in English, but es la que se encuentra más que todo en las carnes rojas, si no estoy mal, ¿verdad?
Actually, it comes from the metabolism of protein, which is in our muscles, which is creatine. Okay. So when we have our regular or normal metabolism, we produce creatine, and from that molecule we create creatinine. So we have our body produces creatinine. However, it could also be produced by the meat in our food. So it could also come from the muscles that we eat when we eat meat, right? So our in a patient who has chronic kidney disease, his or her creatinine levels are way too high. So in this kind of patients, you cannot, well, this patient cannot eat a lot of meat because his or her creatinine levels will increase even more.
Oh, okay. Thank you.
Okay, don't worry. And any other restriction related to diet?
Mm, I don't know, remember.
Okay, maybe salt, because these kind of patients actually have hypertension. So when our patient eats a lot of salt, it would increase our patient's blood pressure. So they cannot eat a lot of salt. Okay, and
Mm,
is there any other way you would help your patient with CKD?
can you repeat the question, please?
Yeah, sure. Yesterday we talked about medical treatment, right? And which is related to medications, and on the other hand, we have therapeutics, right? And it is not also well, it is not. It does not take into account only medications. There's a lot of ways you can help your patient. So besides diet that we already talked about and medications, how could you help your patient who has CKD?
Oh, the medical treatment.
Okay, how could you help with medications just to this kind of patients?
Um, when the situation is very bad, the treatment is dialysis. I don't know in English.
Dialysis,
Dialysis.
yeah. Okay. And is there any other way you could help your patient?
The diuretics.
Okay, great. Diuretics. Okay. I mean, when there's chronic kidney disease, these patients actually tend to increase their water volume, right? Mm, The percentage of water inside their bodies. So it could cause a lot of secondary diseases like hypertension, for example, or even mm, pulmonary edema, right? So that would be a very good treatment, actually. Any other that you might think of?
Um, mm, I don't know in English. Uh,
You can say it in
los
Spanish.
estimulantes, los estimulantes de la médula ósea, los que te ayudan a producir nuevas células sanguíneas.
Okay, you mean like the hormone? Because in chronic kidney failure, there's a hormone, right? Which is, do you remember the hormone that stimulates the production of red blood cells?
Oh,
Las células del aparato extraglomerular producen una hormona, ¿no es cierto?
oh,
Que estimula la producción de glóbulos rojos. ¿Te acuerdas cómo se llama?
sí, está en la punta de mi lengua un ratito. Ah,
It starts with E, right? R, Y, R.
oh, no,
Erythropoietin,
sorry.
maybe, right? Erythropoietin.
Yeah, yeah.
Okay, yes. So in chronic kidney failure, actually, this kind of patients usually have anemia, right? Because these kidneys are not working as they should be, and they not longer produce this hormone. So you could give your patient to reduce a certain degree of anemia, right? So
Yeah.
besides uh, actually we can give our patient this hormone besides this and diet and diuretics. Is and yes, yeah, what else could help your patient?
Sorry, I don't understand. Can you repeat, please?
Yeah, sure. We already talked about, well, you told me about diet, right? And you also told me about some medications, such as diuretics, and you told me about erythropoietin, right? Is there any other way to help this kind of patients?
Oh, vitamins?
Okay. And do you know what kind of complications does this chronic kidney disease have?
The complications
Yeah.
for this.
Yes, from this chronic kidney disease. Besides pulmonary edema that I already told you, right? They actually have a lot of infections. Okay, since they have well, their kidneys are not working as good as they should be, they tend to lose proteins, so they tend to lose antibodies, and they get infected a lot. So mm, having, you know what a culture is? We already talked about it in some other class. I think it was 3 weeks ago. Bacterial culture, they all are always getting that kind of um, laboratory because they tend to get infected really quickly.
Mhm.
Okay.
Okay.
Okay, Danita. So we are done with your 15 minutes. Okay. I'll see you at the end of the class to for the daily survey. Okay.
Okay. Thank you.
Okay. See you later.
See you.
Solo vas a estar mañana, no me digas.
Hello, Diana. Are you here? Breeze, are you here?
Yes, good night.
Hey, how are you doing?
Good, thank you.
Okay, from now on, we have your 15 minutes. Yesterday, we were talking about about medical treatment, right? And therapeutics. Would you like to talk about any kind of disease that you would like to talk about according to medical treatment and therapeutics?
Mm, could be hypertension.
Okay,
Oh, can I talk about the dash diet?
okay, great. The DASH diet, we mentioned it yesterday, right?
Yes.
Okay,
Okay. The dash diet is well, it means the dietary approaches to stop hypertension, and it's like a plan of healthy eating, and it is designed to treat and or to prevent the high pressure, and it includes food with high content in potassium, calcium, and magnesium. And it is because these nutrients helps to control the high pressure, and it limits the foods that has a high content in sodium and saturated fat. I don't know how to say that.
okay,
And
yeah,
sugar too.
great. And what about calcium?
Um. Well, I don't remember very well about calcium.
Okay, so actually, this diet has a higher content of calcium than the regular diet. However, this calcium has to come from low-fat milk.
Oh, okay. I
O-
don't remember that.
Okay, did you read about this diet, or you already knew about it?
No, I've read about it yesterday.
Okay, so you got interested.
Yes, because I've never heard about that. I just heard that it was pretty common that when you are in this stage one in hypertension between 130 to 139, I think, you may start with not with drugs actually.
Yes.
You have to start with making exercise, changing your diet, and that stuff. But I used to listen for my my professors at the university just to eliminate sodium, reduce salt, and
Yeah.
that stuff. I've never listened really about this diet.
Yes, actually, when I was at the university, I didn't hear about it either. I just, when I was reading a book, I learned about it, and that was the first time I read about it, and it was kind of interesting because, as you said, my professors at university usually told us that the patients with hypertension do not have to eat salt and low sodium diet, right? And that was it. I mean, and I always thought there has to be something else, and that's where the dash diet showed up, right?
Yes.
Okay, so besides this kind of diet, is there anything or any way that you could help your patient?
Yes, you can start medication too if the hypertension is in this stage too,
Yes.
and there are angiotensin converting enzyme inhibitors. And the, those mm, those drugs just relax the vessels, and they block the action in order to not form that enzyme. And there is like losartan.
Okay, that's on. Could you tell me the family it corresponds to, maybe in Spanish?
De losartan.
Yes.
Oh, right now I can't remember. I Isn't that a yeca?
Nope. That's actually, for example, enalapril is an ACE, right, in English. And then we have the ARA2, antagonista de receptores de angiotensina 2, right? And that kind of medication is related to that family. And the ACE, which in Spanish would be IECA, inhibidores de la enzima convertidora de angiotensina, that corresponds to enalapril. Okay. Okay. Do you know the first line medications in hypertension?
I think that it's the diuretics.
Okay, diuretics. Okay.
Yes, I think it's because they help to the kidneys to eliminate the sodium and the water from the body.
Okay. Where do you live?
In Cochabamba, Bolivia.
Okay, great. There's actually, well, well, in Cochabamba, you do not have that high altitudes, right? However, here in La Paz, we do. And actually, when a foreign patient comes to Bolivia, actually, that kind of patients come from Europe, right? And they increase their blood pressure. Do you know any kind of medication that could help? You're going to have this kind of patient. I'm sure about it. I'm sure of it. Foreign patient that has increased blood pressure and has really bad headache. What kind of diuretic could you give your patient?
Mm, well, the only diuretic that comes to my mind right now is furosemida, maybe. I don't know.
Okay. Actually, actually, you could that furosemide is actually really powerful diuretic, and it is not recommended. Okay, for that kind of pathology. You actually have you ever heard? I'm going to say it in Spanish for you to understand. Okay, have you ever heard of acetazolamida?
Um, I think it's an inhibitor, a carbonic inhibitor or something like that.
Yes, great. So when you have, and this is an advice I'm giving you, when you have a foreign patient who has high blood pressure and has a lot of headaches, you give your patient acetazolamide. Okay, that is really helpful. I worked here in a clinic dedicated to this kind of patients actually, and we use that drug all the time with this kind of patients. So it's really useful for them. Okay. Uh, any other medication that you might remember now?
For hypertension,
Yes, you chose the disease.
maybe enalapril.
Okay. Yes. And what about have you ever read about what is the first line treatment for a patient who is black?
Oh, no, I've never read about that.
Okay, you have two main medications. Okay, the calcium blocker channels, for example, amlodipino and nifedipino, right? And some other kind of diuretics. I'm going to say it in Spanish for you to remember. Hidroclorotiazida. Have you ever heard about it?
No, I actually can't remember that right now.
Really, it's quite famous actually. So when you have a patient who is black and they actually have really high blood pressure, here in La Paz we have a lot of patients uh, who come from Yungas and they actually have really, really high blood pressure. Uh, for example, I saw patients with blood pressure reaching 200, 150, for example, and they're walking down the street just like nothing's happening. And they actually do not respond that well to enalapril, losartan. They do not respond that well. When you have a black patient, you actually have to think of mm, nifedipino, amlodipino, those kind of calcium channel blockers and diuretics. Okay. Okay. Besides medications and drugs, could you help your patient besides medication and the DASH diet, for example? Any other recommendation for your patient?
They have to change their habits, like start making exercise. Mm, is- that things.
Okay. What else besides maybe weight loss? Maybe.
Yes, it had to. They have to do that too, and to stop smoking too, if
Okay.
they used to.
Okay. And okay, so that would be it, I think, right? So there are a lot of ways you could help your patient, not only medication. For example, you learned about the DASH diet, which you didn't know, you didn't heard of before yesterday, right? So we are done with your 15 minutes, and I'll see you at the end of the class for the daily survey. Okay?
Okay, it's fine. Thank you.
Okay. Bye.
Bye.
Hi,
Hello, hello, Marcela. How are you doing?
I'm fine. How are you?
I'm getting better. Thank you for asking.
Nice.
Okay, so yesterday we were talking about medical treatment and therapeutics. So, would you like to choose a disease you might talk about according to medical treatment and therapeutics?
Mm, yes, well, yesterday I remember I talked about heart failure.
Failure. Okay.
So
Okay.
yeah, I remember the mostly it would be um, well, we saw two parts, the medical part and also some advices to give to this patient. So in and also while I was studying that after the class, I saw there are some surgeries that we can do on this type of patients to try to like, how can I say, I don't know how to express this idea, but to solve the problem of the
Okay.
heart. So, in case of medications, there are like we can use angiotensin converting enzyme
And
inhibitor
enzyme. Okay.
enzyme. Sorry.
Yeah.
Okay. So we can use beta blockers
Beta blockers. Okay. Great.
and diuretics.
Diuretics.
Diuretics. I'm sorry for the
Oh,
pronunciation.
okay. It's fine. Okay. So okay, that is for when it comes to medications, right?
Yes.
Um, what would you like to talk about? Which one of these medications would you like to talk about?
Mm, about beta blockers.
Okay, how do they work?
Well, these try to slow the heart rate and also tries to reduce the blood pressure. Well, as I understood, the beta blockers may reduce the signs and symptoms of heart failure. So the patient, well, I think this uh, this this is going to still happen, but the patient it won't still well feel like the symptoms this strong as it will be without these beta blockers.
Okay, it's like for reducing blood pressure, right? And so the heart does not have to make an extra effort to pump the blood. That's what you meant, right?
Yes.
Okay, great. And what about diuretics? How could those help your patient?
Well, it's the diuretics help the patient to go to the bathroom more frequently to make pee. So doing this action, we try to make take low the pressure of the patient.
Okay, so when a patient has heart failure, if this patient tends to increase the volume of blood, and when this volume of blood is increased inside the vessels, some pressures also increase, which are the hydrostatic and the oncotic actually reduces, right? So when the first one that I told you increases, it makes the water inside the blood vessels to go outside into the tissue. So there would be any kind of edema. And that's where this kind of medications start acting, right? To
Yes.
to decrease the edema. Okay. So besides medication, how could you help your patient?
Well, talking about a change of the lifestyle. For example, starting doing exercise or eating some more healthy food. It could be, well, I just can give advices to my patient, but the process to make any change, it's all matters to this patient. So I could say like what can he or she do or stop doing, like smoking or drinking alcohol, but it doesn't depend on me after that.
Yes, actually, you're right. Some patients actually are not conscious of how serious their illnesses are, and they tend to leave the treatment, quit, and stop doing what you advise, right? So it could be a good recommendation, what you said. First of all, take into account what the patient is able to do or stop doing, right?
Also, I think another thing the patient can do it's like reducing the amount of salt that this person is eating on her daily diet, because the salt improves the levels of blood pressure.
Yes, it actually increases the blood pressure. And do you know how it happens?
Um, in fact, I really don't know, to be honest.
Okay, it's actually sodium, right, is the most powerful. How do I say this? Particle that attracts water. So when sodium is going through the kidneys, it drags. You know what drag is, right? Arrastrar. Okay, so sodium drags water with sodium. So it takes water into the bloodstream. So when a person eats a lot of salt, so sodium increases the volume of water inside the blood vessels, and so it increases blood pressure because there's more blood, in quotes, right? Of blood inside the blood vessels, and so and therefore it increases the blood pressure. Okay, so any other advice you could give to your patient?
I think reduce the stress. It could be help. Well, it's obviously it's a little bit complicated to try to reduce stress, because sometimes it doesn't come. It comes from the environment, but trying to get a little bit slow on the like all the activities you're doing during the day. It could be a way to try to not get a lot of overwork, to say in a way, and without any overwork, you slow a little bit the amount of stress.
Yes. So do you know what the hormones related to stress are?
Mm, I don't know.
Okay, so I'm sure you heard about in Spanish adrenalina, right? That one. And could you think of any other?
Um,
Maybe in Spanish you could say it.
adrenalina in I don't know if cortisol it could be one.
Yes, yes, also yes, great. Any other?
Um, I don't know, but I think the adrenaline helps like to make this make someone to be activated and be careful about the environment, and cortisol it's about an answer from the something I don't know. I forgot this word in Spanish. In English, sorry, miedo. But
Fear.
I don't know any
Yes.
other one.
Yeah, fear. Yes, it's a response to fear and stress, right? And maybe another one would be glucagon in Spanish, and also somatostatina. Those four hormones are related to stress. And what do? They make your heart beat faster and harder. So it increases blood pressure, and it could also in a patient with heart failure, it could lead to an infarction.
Mhm.
Okay. Anything else you would like to talk about? You didn't tell me about ACE, and in Spanish would be IECA y los arados. How do they help a patient with heart failure?
Um, um, AC, you say it right.
ACE in Spanish would be IECA, los IECA, inhibidores de la enzima convertidora de angiotensina, right? And how do those help your patient?
Well, this one tries to relax the blood vessels to lower the blood pressure.
Okay, great. Is there any other way that these medications could help a patient with heart failure?
Mm, I don't-
Have you ever heard about cardiac remodeling in Spanish?
Never.
Remodelamiento cardíaco.
No.
Okay, so when the heart is actually not pumping well, because that is the main point of heart failure, right? And when this kind of patients have heart failure, their hearts actually are overworking, right? And so the muscle cells could die, and they are replaced with collagen. Okay, that is actually cardiac remodeling. So those two, ACE and the other family that we talked about, prevent cardiac remodeling besides reducing blood pressure.
Okay.
Okay, so let me see. Yes, we are done with your 15 minutes, Marcela, and I'll see you at the end of class, please, for our daily survey, okay?
All right.
Okay, see ya. Thank you. Bernardo, are you here? Hello. Hello, Bernardo. How are you doing?
Hi, doctor.
So, yesterday we were talking about medical treatment and also about therapeutics for different kinds of diseases, right? So I'm going to let you choose one disease to talk about both medical treatment and therapeutics. What is it
Doctor,
going to be? Yes.
yesterday I couldn't enter to the class for a bad connection.
Okay. Okay, but you do know, I mean, you're a senior student, right? So you do know what is the difference between medical treatment and surgical treatment, right?
Mm, yes, I think.
Okay, and what about therapeutics?
About what?
Therapeutics. In Spanish would be terapéutica, right?
Yeah,
Okay, do you know what that is?
it's the it's how we treat the patient with what pharmacos
Oh,
or
okay, medical treatment is more related to medications and drugs, and therapeutics is like related also to one part of the therapeutics is actually based on medications and drugs, but it also has a lot of some other components, such as diet, exercise, weight loss, some some other treatments such as physical therapy, maybe a patient who needs a checkup with ophthalmology. So it's like a more global view. And medical treatment is only related to medications. Okay. Okay. So could you choose any disease that you might like to talk about and related to medical treatment and also to therapeutics?
maybe tuberculosis.
Okay. Okay, great. So, um, what could you tell me about, first of all, what you know about um, medical treatment? So it means medications in tuberculosis.
Um, in Bolivia, we have like different treatments for that, for uh, escalones. I don't know who will say in English.
Okay.
And the first is when the first treatment for the patient who, and it's we there we have like 4 drugs. I don't remember who was cuáles son. And after is the persons have uh, who just leave the treatment, and they have drugs more strong, and patients who has uh, allergic to the first drugs, but I don't remember the name of the drugs.
Okay. And besides medications, how could you help your patient with tuberculosis?
Mm, the patients who have these issues, it's more with they don't have uh, these types of the person has fo- force, and they don't eat well, or they don't have great nutrition. So first it's the nutritions, and mm, I don't know what more.
Okay. So they actually tend to get really skinny, right? They're really skinny people. Since you're right, and you could also tell your patient to go to nutrition, and they would help your patient to gain some weight, right? Um, Actually, this kind of patients tend to have a really weak immune response. So, how could you help in this part of the treatment?
Mm, maybe give more carbohydratos. How I say carbohydratos?
Okay, it's carbohydrates. However, we actually call them carbs, just carbs.
Give more carbs and proteins.
Okay. Besides diet, is there any other way you might be able to help your patient?
Mm, say who don't stay on a room without uh, without good ventilation.
Venting, okay. Okay, so the patient, to make sure he's not contagious to other people, right?
Yeah.
Okay, great. Any other recommendation you might give your patient? Or is there any other way you might be able to act? For example, they have a really weak immune response, right? And so you would have to look for some other diseases. For example,
Take a lab for BH,
HIV.
HIV.
Yes, great. Okay, so HIV, you would have to think of HIV also when you have a patient with tuberculosis. Anything else?
Yes, I think just that.
Okay, is there any other disease that you might like to talk about? Because in infectious diseases, the most common treatment is actually based on antibiotics, right? And if the patient has a good response, well, um, the patient could reach the cure because we could actually get rid of in this case, bacteria. So is there any other disease, for example, I don't know, I gave an example yesterday and it's the easiest one, actually, hypertension.
Oh,
Okay, so how could you help a patient with hypertension besides um, medications?
in medications. Take a antihipertensivo, un antihipertensivo.
Yeah, and what besides that kind of drugs, is there any other way you could help a patient?
Yes, saying to change his life for uh, signs the who eats and make more sport.
Okay, have you ever heard about the DASH diet?
I think so, but I don't remember. It's low of carbs, high on proteins, maybe.
Okay, and what about calcium, potassium, magnesium,
It
sodium?
low in sodium,
Yes, great. And what about calcium?
uh, maybe high.
Yes, actually high, but in low-fat milk. Okay, any? And what about potassium?
High.
Okay, great. And where do you find this in food?
Uh, the potassium
Yes,
in the salt.
salt, but actually salt. It's
Uh,
not related to hypertension treatment, right? It is
yeah.
actually going to hurt our patient. Okay, so maybe vegetables, grains, cereals, that kind of food has potassium. Okay, so those kind of food you could tell your patient to eat. Okay,
Uh, w- Doctor, here in
yes.
Bolivia, I hear oh, where the vegetables don't have many potassium.
Okay.
So it's that for the salt has more, the industries put more potassium in the salt.
Okay, but actually, when we're talking about a hypertension treatment, we have to
Yeah,
avoid sodium, right?
yes.
So
Uh,
grains would be a better option. Grains and cereals.
and if I see it's the patient has a low in potassium, I have to put, or I don't know.
When you have a patient who has low concentrations of potassium,
Yes,
uh,
yes,
uh,
low concentration.
okay, you actually have to give your patient potassium when he has or she has low concentrations because hypokalemia is actually related to some kinds of arrhythmias. Hyper and hypokalemias are related to some arrhythmias. Okay, so when you have some um, some of this, let's say, altered concentrations in potassium, you do have to act because it could be even really dangerous for your patient. He could even die, especially when there's high concentrations of potassium. However, low concentrations is also related to arrhythmias, okay? And there are actually some guides on how you have to do it. I'm going to upload a book for you to read about it, okay?
Okay.
Okay, I think we're done with your 15 minutes, Bernardo. And remember, at the end of the class, please join for the daily survey, okay?
Okay.
Okay, see you later.
See you. Thank you.
Okay, you're welcome. Paola, are you here? Hello.
Hello.
Hey, Paola. I'm sorry, you're the last one. I promise next time you will be the first one, okay?
Okay, thank you.
Okay, Paola. So yesterday we were talking about medical treatment and therapeutics. Could you choose any kind of disease you might like to talk about? Um, Medical treatment and therapeutics?
Hypertension, right?
Okay, hypertension. What could you tell me about this disease?
Have high pressure or heart rate, heart rate, heart rate frequency. I don't know. I don't explain a lot, but I would like to learn a lot of this topic because it's very interesting for me and pharmacology and treatment and therapeutic about this disease.
Okay, so what could you tell me about the um, the medications that you could use in a patient with hypertension?
I learned the type of drug. I saw yesterday that the type of or drug is ACE and ARBs.
Okay, and do you know any examples of those two families of medications, of drugs?
I remember the Sorry, what?
Mm, do you know any kind of examples? Could you give me an examples related to both families of drugs, to those two, to the ACE and in Spanish, Arados?
Um, I don't know. All of this pharmacology, this drug. I would like to explain this. The most medications about the importation.
Okay, ACEs, maybe you could say enalapril, lisinopril.
Yeah.
Okay, those two. And what about the other one? Do you remember?
Mm, Losartan.
Great, yes. And how do they act? Do you remember?
Lowers blood pressure.
And how did they do it?
Um, I know that. Uh, hmm, I remember the Nalapril. I don't know. I know that in Spanish I can explain in Spanish and Nalapril.
Okay.
I heard it this name in the last year.
Okay, you could say it in
Eh,
Spanish if you would like to.
Sé que si una embarazada toma Nalapril, eh, puede causarle daños al feto, pero aún no sé cómo, por qué es que esto es tan fuerte si se utiliza también para la hipertensión. Y si una embarazada no puede tomar Nalapril y si tiene también hipertensión, ¿cómo es que puede ayudar?
Okay, in pregnant women, we actually have this kind of medication, which is, I don't know if you ever heard about alpha methyl dopa. Have you ever heard about it? Or methyl dopa?
No, I don't heard this.
Okay, so you are right. A pregnant woman cannot make use of enalapril. It tends to hurt the baby, right?
Yeah.
So, do you know how do you know the name of this family of drugs in Spanish?
Um, mm, no, really. I don't know this classificate this medicine or this drug.
Okay, it would be inhibidores de la enzima convertidora de angiotensina. You must have read about
Okay.
this system in Spanish, el sistema renina angiotensina aldosterona. You read about it, right?
Yeah.
And
Yes.
could you tell me a little bit about that system?
Okay. I remember that I remember that how do you say regula?
Okay, controls or regulates
Yeah, controls the pressure sanguínea.
blood pressure.
Regula la presión sanguínea. Yeah. And in Spanish, también el volumen extracelular corporal y el balance de sodio y potasio.
Okay, and do you know how it does it?
Um, yeah, this enzyme, I could say in Spanish that I know this concept in Spanish. It's very easy for me say it in Spanish.
Oh, okay, but yeah, when you're done speaking in Spanish, you're still going to tell me in English, okay?
Yeah.
Okay, so go on.
Um. Okay. I will explain in Spanish. I could try. This enzyme catalyzes the conversion of angiotensinogen, a glycoprotein secreted in the liver, into angiotensin 1, which in turn, by the action of the angiotensin converting enzyme, it's converted into angiotensin 2. Um, I remember that one of the effects of angiotensin 2 is the release of aldosterone through the cortex of the adrenal gland.
Okay, and what does this molecule do? Aldosterone, right?
Yeah.
And what does aldosterone do?
Which?
Aldosterone, right?
Oh, yeah.
How does aldosterone act?
Okay. This is related to sodium.
Yes.
It acts in the conservation of sodium, in the secretion of potassium.
Yes.
And in the increase of the blood pressure, right?
Yes. Okay, great. So besides medical, like some drugs, besides drugs or medications, how could you help your patient with hypertension?
Control the system regina angiotensin.
Okay, and besides drugs and medication, how could you help your patient?
Mm, how with hypertension, right? I only just give this medicine.
But
Uh-huh.
okay, okay, you were saying?
No, I'm just saying the enalapril or losartan. Losartan, I don't know this work, this medicine. I don't know how works this medicine.
Okay, you're going to learn it your next year, I
Yeah,
think, right? And
yeah.
besides medications, besides drugs, I mean,
Mm-hmm.
forget about drugs now and tell me how could you help your patient with hypertension in any other ways that are not drugs?
Um, Let me see. Um, I I say the other treatment. He eats healthy foods. Maintain a healthy weight. Um, I would say that increase the physical activity and limit alcohol and don't smoke. I think this treatment is very um, easy to do, and yeah, I will recommend it to my patient. Do you hear me?
Yes, I was listening. And do you remember what the DASH diet is all about?
What I don't catch it.
Okay, yesterday we talked about the DASH diet. Do you remember?
Uh yeah. Uh, Dietary
Yes.
approach, stop and hypertension.
Okay, so it's the dietary approach to stop hypertension. And how does this work? I mean, what is related to it?
Okay. I remember that dietary is I saw this in a square that have calcium. It's low fat milk approach, potassium.
Okay.
Remember calcium, potassium, and vegetables, and potassium. Uh, it's grains. I saw this is like yesterday.
Yes.
Potassium, grains.
And what
I
about
would like
sodium?
um I think that sodium it's I read it like I sorry I say it I said the sodium I the regine aldosterone, right?
Yes. And however, the DASH diet is also related to sodium. Actually, it is related to a low concentration of sodium in foods to reduce the blood pressure. Okay.
Yeah.
Okay, so Paola, we are done with your 15 minutes, and please stay for the daily survey, okay?
Okay.
Okay, see you.
See you. Bye.
Okay, thank you for joining, guys. We're going to go with the daily survey, okay? Let me know when you're done.
I'm done.
Thank you. Okay, I think that would be it. Tomorrow we're having our theoretical class and also our practice class, okay? So guys, have a good night's sleep and I'll see you tomorrow. Bye guys.